Five-month-old Matilda Oluka weighs just 4 kilograms, far short of the 7 to 9 kilograms a healthy child her age should weigh. Matilda is an orphan under the care of her grandmother Immaculate Egwang, a resident of Kamolo sub-county in Palisa district. The frail little girl was started on millet, greens and cassava as soon as she could eat. But a meal is only possible whenever her grandmother gets the food to feed her. This is all poverty-stricken Egwang can do. Besides, she has to struggle to feed 11 other children left in her care after her 2 sons died. This is little Ivan Chedi. The 7-month-old is a victim of malnutrition. He weighs only 6 kilograms, 2 kilograms less than what an infant his age should weigh.
The problem is now becoming intensive because of these repeated attacks of malaria.
Malnutrition is one of the biggest health problems encountered at Palisa Hospital. Each day, the hospital receives children seeking medical expertise for mild to severe forms of malnutrition. And close in tow are expectant mothers who are equally malnourished.
The total deliveries at the health unit during this period 2008-2009 are 12,221. Children who are born below 2.5 kilograms, there are 315.
The consequences of poor feeding can certainly not be underestimated.
So if the mother is receiving little, it means even the baby gets affected. Yes. So the mother gets ill health, and sometimes they end up with complications like anemia. And those with anemia can easily, they tend to bleed.
If the food doesn't reach to the brains, certainly the brains doesn't develop properly, and as a result, people tend to be dull.
When malnourished mothers and underweight children are identified, they are encouraged to report back to the hospital after a few weeks for follow-up. However, the long distances to health centers and the lack of community support mean that few women return to hospital for postnatal care, in turn missing the opportunities to improve the health and diet of their children. But health workers confess there is no exact data pointing to deaths resulting from malnutrition. Deaths are normally associated with other life-threatening conditions like malaria. In general, dwindling food portions have had a heavy impact on the already poor population in Palisa district. For several people here, finding just one meal a day is gradually becoming impossible. As a result, mothers are resorting to eating and feeding their children with cassava, which only has one nutrient, starch.
I think poor feeding is causing my children sickness. They are always getting malaria attacks, and when I take them to hospital, they tell me they are anemic and need to eat better.
At times we get prolonged droughts, and these normally affect the crop production.
Most of these business people come and buy. Even fruits which used to remain there are no longer there. They are bought. So I feel there is a degree of food insecurity cropping in.
The district agriculture production officer, however, attributes the problem to the failure to balance the available foods to maximize food nutrients, not to the lack of food to feed the children and women of childbearing age.
The line between the commercial and the food crops is not there. So people prefer to sell chicken and the eggs other than consuming them.
Agriculturalists in the district suggest that more fertilizers are needed in order to improve food productivity, while ensuring proper land management as one solution to the food shortages. Such proposals are in hand with sensitization and education of mothers on the importance of a balanced diet. Certainly, the delegates from all over Africa meeting here in Kampala to deliberate on how to save African mothers and children have a lot on their plates on how to resolve the poverty that is still the root cause of all the life-threatening conditions for this vulnerable population. Leah Wanika, NTV.